This is Katrin with Disability Rights New York. Welcome to our podcast, Empire State of Rights Closed Captioned. We are here to bring you information on the most relevant topics regarding disability rights and advocacy. As New York State continues to address the coronavirus pandemic, Disability Rights New York will be recording podcasts specifically targeted at bringing you up-to-date information and resources. And we will do our best to get you information as it changes. If there is a topic that you would like us to address, please comment below or email us at podcast@drny.org. Today, we welcome DRNY staff attorney Laura O'Brien. She's here to discuss having a support person while hospitalized during the COVID-19 emergency. Laura, thank you so much for being with us today.
Thank you.
So, Laura, let's get right into it. There's a lot of information that's being circulated through the media about what our rights are, what's changing as this pandemic continues. And so one of the questions will be, can a hospital stop a person from having a visitor during the COVID-19 pandemic?
So they might be able to. New York State Department of Health has stopped visitors to the hospitals to protect patients, but patient support persons are allowed into the hospitals for some patients.
Okay, so can a person with a disability have a patient support person at their bedside, close to them, with them in the room?
Yes. So a hospital has to let a person with a disability have a support person if they fit into categories of an intellectual disability, developmental disability, or a cognitive impairment like dementia.
And who should your support person be?
Your support person has to be someone who's essential and someone who's familiar with what you will need. And it's recommended that your support person not be over the age of 70.
So, Laura, let's talk about and let our audience know, what does a patient support person actually do?
So a patient support person helps you while you're in the hospital so that you can get the medical care that you need. So if it's someone who is familiar with your care at home, they can tell the nurses and doctors and healthcare workers what you'll need in the hospital as well.
And there may be some questions about who gets to choose who the support person is. Can a person with a disability choose their own support person?
Yes. So a person with a disability gets to be part of the conversation and choose who they want to be their support person with them in the hospital.
And so before going to the hospital or when you're in the hospital, talk to us about what the steps are to letting the staff know at the hospital that a patient support person is needed or that they're wanted. Are there certain requirements that people need to go through before they get to the hospital?
So everybody will have to be screened. Any support person will have to be screened. And what that means is they'll check for fever or cough or other symptoms of the coronavirus. And so they'll screen everyone before coming to the hospital. And if you go to the hospital without prior warning, they will do that when you get to the hospital.
And so should you call the hospital ahead of time and let them know that you want to have a patient support person or that you need a patient support person? Is that something that our audience should be doing if they are in this situation?
Yes, if you have the ability to call ahead of time, it will help to potentially streamline the process so that when you arrive with your support person, the hospital knows that you are an individual who is qualified to have a support person under the guidance set by the state.
And you touched on this just a minute ago, but let's talk a little bit more about what the requirements are when it comes to who can be a patient support person.
A patient support person is someone who is familiar with your needs and who can help direct medical staff to provide the best care for you.
So talk to us about what happens if, say, you choose a support person and this is who you want to have with you, and it turns out that they're sick, they have a fever, or they miss out on one of the requirements. What happens then?
You'll be able to pick another support person at that point, because if your original support person starts to show symptoms or starts to appear to be sick, then they will not be allowed to be in the hospital with you, but you will get that opportunity to choose a new support person to be with you.
That's really good information. And so as the hospital staff is deciding whether or not a patient support person is needed, regardless of whether they're wanted, Does the patient have an opportunity to give input on that? Can they be part of that conversation and saying that, yes, in fact, a patient support person is needed for me?
Yeah, so as the patient, you should absolutely be a part of the conversation, and the conversation should be in language that you understand. It should be plain language so that you know exactly what your rights are to have a patient support person.
And is there any documentation that you need to bring to the hospital to verify to the staff and to the hospital that whether you have a qualifying reason for having a patient support person?
So it's not required to bring documentation, but in order to show that you are a person who qualifies to have a patient support person, it might be helpful to bring a healthcare proxy or guardianship order or a document like that that shows that you have this person to help you in everyday life, to help you in healthcare situations.
And should your patient support person also have documentation, identification cards with them, and things like that?
Yes. So if you're bringing documentation of who your guardian is or who your healthcare proxy is, it could be helpful to bring their ID to verify who that is. You should be able to choose your support person, even if that's not the designated person on your healthcare proxy or your guardian, but it could just be an additional safeguard to make sure that you are able to bring in your support person.
And as you said earlier, if it's possible and you're able to let the hospital know before you get there, then that's a good idea, a good practice to have in place. Now, a lot of people will be wondering if they can talk with their family or friends or their caregivers when they're in the hospital, even if those people are not their support person. Is that possible?
Yes. So hospitals should be trying to implement ways for patients to speak with family members, loved ones, friends while they're in the hospital. But right now, it's not a requirement for them to set up these alternative methods of communication. But this could be phone calls, FaceTime, Skype, or other video services so that you have that opportunity.
And so as someone ends up becoming a patient in a hospital, they might be interested in knowing if there will be other people, whether it's on their floor or in the hospital, who also may have patient support while they're there. Is that possible?
It is possible, but the patient support persons are supposed to remain in the room with you, with the patient at all times. And some hospitals, if the patient support person leaves the room, they will be required to leave the hospital.
And who are some other people who may be eligible for having a patient support person with them?
Women who have just had babies or are in labor, and children are also individuals who are able to have a patient support person with them.
So, Laura, there's a lot of information here, and the information certainly may change in the next day or week as this continues. Is there an organization that people can contact if they have questions?
Yeah, if you have questions about your rights during this emergency, you can reach out to DRNY and we might be able to answer your questions or help in certain situations.
Thank you so much for your time today, Laura. Really great information.
Thank you.
Empire State of Rights Closed Captioned has been brought to you by Disability Rights New York, your source for disability rights and advocacy. If you enjoyed our program, make sure to subscribe, like, and share this post. If there is a subject you would like us to discuss, please email podcast@drny.org or comment below. Tune in next time where we'll bring you more information on disability rights in the state of New York. The closed caption version of this podcast is available on our YouTube channel. To listen to more Empire State of Rights closed captioned, follow us on Apple Podcasts and Spotify.